Do you feel that it's kind of like the old ways versus the new? Because scalability, if you brought in healthcare practitioners, not doctors, but healthcare practitioners to see through a lot of these lifestyle changes. I mean, listen, there are wonderful NPs, PAs, nurses out there, so many more than MDs that probably aren't as indoctrinated into the old ways and would be able to serve as scale. But you would then need the patients in those group sessions to put their trust and faith in someone that's not a doctor. Do you think that's a viable option as we move forward and we start to see experts who don't have MD on the end of their name giving out a lot of health advice and information that people are actually listening to and getting better, more so than their MD gave them?
Well, it's an interesting question. And there's actually a very left field answer for this, which is, I think you're going to like. So from our experience, any sort of expert running the group doesn't really work. And when I say expert, I mean doctor, nurse practitioner, dietitian, even nutritionists. Like, that doesn't really work. And the reason is because there's this sort of like, I think there's a number of reasons, but one of them is that like there's this historical sort of sort of dynamic between patient and expert, right? Where one's above the other. And that's really the opposite of what you're trying to make happen in the groups. You're trying to empower the patients, right? You have to see them as capable. And so we've actually found that the most successful person to run these groups is actually what is called a health coach. And the reason why the health coach is really valuable is, one, they typically have some patient experience of being the patient in that situation, right? So how do you get a group of patients to really feel safe enough to participate in a group if the first thing that they hear is that someone who's kind of like them, had an issue that was kind of like them, and they did this, this, and this, and now they don't have that issue? That is extremely reassuring and trust creating in a way that a doctor says, well, if you do this, this, and this, you'll be fine, but it hasn't worked up until now. That's a piece. So, and also a health coach is a very scalable, person, right? It only takes 6 months to a year for them to like go through their training, and then they have to have some experience in doing it. But ultimately, what you're not is an expert. What you are is really a facilitator. And the way that we've sort of got around the issue that you're sharing there is that, we've created a bulletproof program. That program is prescribed by the doctor. So all the information there is sort of coming from the doctor as far as like what to do. The coach is really there just to help you be accountable to that process. So what we've done is sort of really thought about team-based care, who should do what, which parts of it are scalable, where is the trust, where is the skill set, and sort of come to what we think is a pretty elegant solution, to essentially scale group delivered care. And it's not necessarily a replacement for one-on-one care. We definitely think that, that there's plenty of examples and data. Now, if you look at the British Medical Journal, April 2021, that showcases that the group outcomes at the Cleveland Clinic Center for Functional Medicine, you'll see that the outcomes are sensational. The costs are lower than one-on-one care. The outcomes are better than one-on-one functional medicine. And there's many reasons for that. But what I've seen more than anything over the last 3 years of doing this pretty intensely is that, creating trust, solving loneliness, creating connection is the most important thing. And we found that, doctors have said things to us like, when they go into these groups, they say, patients have shared things into the group that they haven't shared with me. And I've been their doctor for 7 years. And so there's a level of trust that's created in a group of peers where you don't have the doctor involved that I think is a really powerful force for scale.
Yeah. The one thing I've always thought about medicine that was lacking growing up in the industry and everything is the humanization, the ability to emotionally tap into each patient, connect, which most experts and doctors don't do. But you're right. It is those health advocates, ambassadors, those health coaches that usually have their own conditions that they've gone through that you're able to then empathize. And that's really what so many patients seek. They don't seek the professionals. Listen, if that were the case, conventional medicine would be amazing if everyone just wanted the science and evidence. But that's definitely not enough anymore. you need sounding boards as you start to heal, I've realized. And most of these patients out there, that's what they're looking for. When you give them that ability to speak longer with a doctor, sometimes that's not enough. And so I do agree with you there. And part of that, of what we're talking about, is this idea of loneliness. Experts can make you sometimes feel lonely and, just isolated, where this group sort of session can get rid of that in a sense and combat that.